Today, we are going to talk about a condition that affects millions of people worldwide, often without even knowing it. That is insulin resistance. You know that insulin resistance is a hidden health problem affecting many people. Around 1 in 3 adults worldwide have insulin resistance without even knowing it. Research shows that insulin resistance can begin 10 to 15 years before the diagnosis of type 2 diabetes. So, this is silently affecting our metabolism and especially overall health of an individual. It is also strongly linked to weight gain, fatty liver disease, PCOS, cardiovascular diseases, and prediabetes. Hello, I am Dr. Pooja Ambati, certified diabetes educator, clinical nutritionist, and dietitian. To understand insulin resistance, we must know or we should first need to understand what this insulin is and what is the role of this insulin in our body. So, what is this insulin? This insulin is a peptide hormone. So, it is secreted by the pancreas, mainly by the beta cells of islets of Langerhans. And what is its role? It maintains normal blood glucose levels by facilitating cellular glucose uptake and thereby regulating the carbohydrate, lipid, and protein metabolism. So, in simple terms, insulin is a hormone, and think of it as a key that opens your cells so sugar in the blood can enter and be used for energy. But sometimes these locks become stiff. If your cells don't respond well to insulin, your body is insulin resistance. So, in simple terms, the main job of insulin is to help glucose or sugar from the food we eat move from the bloodstream into our cells, where it can be used for energy and other metabolic activities in the body. So as I said, think of insulin as a key and your cells as doors. So when everything happens or whenever everything is working properly, insulin unlocks the door, allowing the glucose to enter the cells. But in insulin resistance, the lock becomes rusty or stiff. And the key we have, the insulin is still there, but it does not work as effectively. So what is the result? As a result, what happens? Glucose stays in bloodstream and the pancreas has to produce more and more insulin to compensate. This means sugar builds up in the blood. It is not same as diabetes, but it can lead to prediabetes or type 2 diabetes if we don't act upon it. Or if we neglect it, it leads to prediabetes condition and type 2 diabetes. So this is about the insulin and the insulin resistance. So people ask what are the symptoms and what are the signs so that I can watch for. So most people with insulin resistance feels absolutely fine and there might be no symptoms at all. You can see like as sugar levels gradually raise, people feel tired, more hungry, or have trouble in concentrating in whatever the work they are doing. So we have to look for subtle signs. So it can be skin tags or dark patches. So as we have discussed, that is acanthosis nigricans. Like these patches will be on neck, underarms, or in the groin region. Or there can be unexplained change in the weight. So all these are the signs you can watch for. If you are neglecting these signs and this insulin resistance progresses to prediabetes or diabetes, classic symptoms occur. So this can be thirst, frequent urination, or frequency of eating will be more hungry, and there can be blurred vision. So all these symptoms appear.